When you hear the word anxiety, what do you think of? Does it trigger something inside you, or perhaps a fear or an event in your life? Or maybe you think of a movie character like the 2001 comedy Bubble Boy, and in the film the title character was born with an immune deficiency disorder, so his mother puts him inside of this rubber bubble to keep germs away. She has anxiety about the germs, anxiety about her son getting sick. Yet in the movie, the disorder was not something that was going to last a lifetime for the boy. It was not something that was going to affect him for his entire life. And yet the mother keeps him in the bubble because of her anxiety that her son might die. So she keeps him in this bubble for his entire life. See, anxiety is a disorder where someone worries and fears about potential dangers, upcoming events, or even how past events might affect their future. And anxiety can reveal itself in many different ways, and it can affect people both mentally, physically, and behaviorally. But I want to propose this thought before we get any further. I want to propose a thought that God created us with anxieties for a reason. Now hear me out. Anxiety in itself, we might think of as being all bad. And yet, a healthy part of anxiety allows us to fear certain things that are in a positive way. For instance, if you see a snake, anxiety says run away. If you encounter someone that might want to harm you, the idea is, hey, I want to push away from that. I want to get away. And so when we have these moments, there's an intense part of us that are mentally and physically, we start going into this flight mode or this fight mode, and it's caused by this healthy anxiety. But what qualifies as an unhealthy anxiety? Like, when do we separate unhealthy from healthy anxiety? Again, there's a normal and reasonable amount of anxiety that people incur, but when it becomes persistent, exacerbated, or irrational for extended amounts of time, we now have what we call an anxiety disorder. And according to the National Center for Health Statistics, women are almost 2 times as likely to experience an anxiety disorder than men. Yet, some researchers are questioning if this statistic is truly accurate. A 2022 study by Fisher et al. 2022 calls out social and societal and cultural attributes of masculinity like invulnerability, toughness, and unemotionality as reasons why men don't or are unlikely to seek help with anxiety disorders. And it's exacerbated by roles that men take on, like provider, protector, and so on. And these are ingrained in us as men, and yet these researchers, these scholars are saying this might be the reason why we don't see heightened levels of anxiety or diagnosed anxiety in men. Though there are different types of anxiety disorders, we're going to focus primarily on 2 different ones, and that's generalized anxiety disorder, or GAD, or social anxiety disorder, or SAD. In generalized anxiety disorder, to be diagnosed with it, you have to have 1 or 3 of these 6 symptoms for an extended amount of time, and that extended amount of time must be at least 6 months or more. And they have to be 3 of these: restlessness or feeling on edge, being easily fatigued, or having difficulty concentrating. They might be irritable, or they might have increased muscle tension, or they may have trouble sleeping. But you must have 3 of those, at least 3 of those, for at least 6 months. And now with generalized or GAD, the DSM-5-TR does not specifically say that there's a specifier for GAD. But if we look at all the other anxiety disorders or phobias and panic attacks and so forth, these things are kind of like specifiers for GAD. And as we assess a patient, and the better we assess the patient, we're going to be able to come up with an appropriate treatment plan for them. And in itself, GAD is a modifier for other psychiatric disorders, especially prevalent in people who suffer from major depression disorder. And in social anxiety disorder, it's marked by people that have an overabundance of fear of social interactions or having conversations with people or unfamiliar people. They may have a fear of eating around other people or going to specific events. And specifically, we see that childhood trauma actually has an increased effect on people that have social anxiety disorders. So fear, anxiety, and the avoidance is persistent in people with social anxiety, and it typically lasts for at least 6 months. Specifiers on this, and I find this interesting, are performance or performance only specifier for social anxiety. And someone that comes from a sporting world, we call this the yips. We call it the yips. It's someone that has a social anxiety fear of performing live. Like, they could be perfect in practice. They might be the best musician, the best dancer, the best performer, the best baseball player, the best football player. But when it comes to doing it live or in a game setting, they fall. They got the yips. And that's what performance only looks like. But it also could manifest itself in school or other academic settings or even in work settings. But for all of these, no matter what anxiety disorder we have, research indicates that cognitive behavioral therapy, or CBT, is the gold standard treatment for treating anxiety disorders according to Curtis 2021. And furthermore, the importance of having an accurate diagnosis of what anxiety disorder is and what a patient suffers from is imperative to knowing which CBT intervention is best for their treatment. So if you're suffering from an anxiety disorder, it's important that you seek help, because undiagnosed and untreated anxiety can manifest itself into more severe mental health issues like major depression disorder. And it can also manifest itself into further suicidal thoughts and behaviors. So if you're suffering from an anxiety disorder, don't look into your masculinity. Get help.